ACUWEBINARs 2. According to TCM, which pair correctly encapsulates the two components of its holistic concept?
The human body is an organic whole and the unity between the human body and nature.
In TCM theory, which organ group is considered the core around which all other bodily parts are linked?
The five Zhang organs.
Which of the following best explains why in spring and summer TCM says Yang Qi disperses?
The external environment is warm, prompting yang qi to rise and open pores for sweating.
How does TCM describe the body's response to cold seasons regarding Yang Qi?
Yang qi is stored, skin tightens, pores close, and urine output increases.
Which daily pattern of Yang Qi movement aligns with TCM's description of its diurnal rhythm?
Rises in the morning, flourishes at noon, retreats at night.
According to TCM, the functional activities of the Zangfu organs are primarily promoted by which qi?
External yang qi during the day.
Which modern physiological phenomenon most closely parallels TCM's concept of seasonal adjustment of sweat and urine output?
Thermoregulatory sweating in sweat and
Heat.
antidiuretic hormone increases in cold.
Okay. That's heat. I think you can, hindi mo na mabasa yung, do you need, ano?
My screen is moving around fast. Wait.
Number 8, in the context of TCM's geographical influence, which factor is least likely to directly affect the body's physiological activities?
Local dialect spoken by residents.
Which of the following statements best reflects TCM's view on the body's adaptability after relocating to a new environment?
The body gradually adjusts its qi and fluid dynamics to accommodate the new climate.
TCM attributes the coordination of essence, qi, blood, and body fluid to which structural system?
The meridian and collateral network.
Which seasonal transformation described by TCM would most likely correspond to increased activity of the liver in modern biomedical terms?
Spring's upward yang qi dispersal.
In TCM, which organ pair is most directly involved in regulating the opening and closing of skin pores?
Lung, fu, and skin white qi.
Which TCM principle explains why nighttime is associated with yin dominance and internal storage of yang qi?
The principle of yin-yang transformation across the circadian cycle.
Which modern scientific field studies phenomena most akin to TCM's unity between the human body and nature?
Ecophysiology.
According to TCM, which of the following would be considered a pathological influence on the interrelationship of organs?
External wind cold invading the superficial layer.
In TCM, the 5 tissues are linked to the Zhang organs. Which tissue is primarily associated with the heart?
Blood.
Which of the following best illustrates the TCM concept that essence, chi, blood, and body fluid work together to accomplish bodily functions?
They act as interdependent components of a unified energetic system.
How would TCM likely interpret the physiological effects of moving from a high-altitude cold region to a low-altitude warm coastal area?
Initial yang qi excesses leading to sweating, later gradual qi redistribution.
Which TCM seasonal recommendation aligns with the principle that yang qi disperses in summer?
Eat light, cooling foods to prevent excessive yang.
In the context of TCM's holistic view, which modern medical concept most closely parallels the inseparability of body parts in structure and function?
Systems biology.
Which organ's qi is associated with the sense of hearing?
Kidneys.
In the classic of difficulties, how many upper orifices are counted when the eyes and ears are considered as pairs, but the nose as a single entity?
7.
Which of the following senses is explicitly excluded from the 9 orifice model?
Touch.
The heart qi communicates with which anatomical structure?
Tongue.
Which organ is responsible for distinguishing the 5 flavors according to the classic of difficulties?
Heart.
The spiritual axis links a greenish coloration of the eyes to disease in which organ system?
Liver.
If the lips appear black, the spiritual axis attributes disease to which internal component?
Muscles.
Within the 9 orifice framework, which 2 lower orifices are both under the influence of the kidneys?
Urethra and anus.
The sense of taste is linked to 2 yin organs. Which pair correctly identifies those organs?
Spleen and heart.
According to the classic of difficulties, which organ's qi would be disrupted if the nose fails to detect odors?
Lung.
The spiritual axis associates a dry and dirty ear with disease in which organ?
Kidneys.
Which of the following accurately reflects the relationship between the 5 senses and the 5 yin organs?
The taste is the only sense linked to 2 yin organs.
If a patient exhibits a yellow coloration of the lips, which internal organ does the spiritual axis suggest is primarily affected?
Spleen.
In the enumeration of the 9 orifices, which of the following is incorrectly paired with its category, upper versus lower?
Anus and upper.
Which organ's qi would be implicated if both eyes lose the ability to distinguish black from white?
Liver.
The classic of difficulties assigns the sense of smell to which organ, and what is the physiological implication if this organ is out of harmony?
Lung. Inability to detect odors.
Which organ is linked to the sense of sight, but not to any taste function?
Liver.
The spiritual axis connects a moist and thin area between the eyebrows to disease in which tissue, and which organ is that tissue associated with?
Skin. Lung.
Considering the 9 orifice model, which statement best captures the hierarchical relationship between yin organs and orifices?
The 5 yin organs collectively influence the 7 upper orifices, while the kidney alone influences the 2 lower orifices.
Which acupuncture point marks the origin of the external pathway of the small intestine primary channel?
Small intestine 1.
The branch that separates from the heart primary channel to join the small intestine primary channel does so at which point?
HE9.
At do 14, the small intestine primary channel meets the extraordinary vessel known as what?
Do Mai.
Which point is designated as the lower Hussey point of the small intestine in the classical text?
ST39.
The internal branch that originates at stomach 12 travels inferiorly to which paired Zhang organ?
Heart.
A branch from SI18 connects to which point at the inner canthus of the eye?
GL1.
Under the six-channel theory, the small intestine primary channel, the Han-Yang, is paired with which foot-Yang primary channel?
Bladder primary channel.
Which of the following exterior signs is not associated with the small intestine primary channel?
Lower back pain.
According to the organ clock, the small intestine primary channel shares its circadian rhythm with which other primary channel?
Heart primary channel.
At the elbow, the external pathway of the small intestine primary channel passes between which two bony landmarks?
Olecranon and medial epicondyle.
Which physician originally authored the record of the golden mirrors?
Ow.
In what year did Tu Chingpi publish his revised edition of Ao's work?
1341.
How many new illustrations did Tu Chingpi add to the revised edition?
24.
Which of the following tongue body colors is not mentioned in Tu Chingpi's work?
Green.
Which of the following tongue surface alterations is described?
Red prickles.
The original record of the golden mirrors primarily addressed tongue diagnosis in connection with which type of disorders?
Cold induced.
Which classical text is referenced as the source for cold-induced disorders in Ao's work?
Discussion of cold induced disorders by Zhang Zhaoxing.
Which of the following is not a tongue coating color listed in the revised edition?
Pink.
Tu Chingpi's manual includes analysis of each pattern in terms of two dichotomies. Which pair is correct?
Deficiency, excess, and hot or cold.
Beyond tongue description, what additional clinical information does each illustration in Tu Chingpi's book provide?
Pulse and pattern.
Why is the radial artery specifically used for pulse diagnosis in Chinese medicine?
Because lung channel flows there and the lungs govern qi.
Which organ is described as the most important organ influencing the pulse from both Chinese and Western perspectives?
Heart.
Qi is the commander of blood and blood is the mother of qi. What implication does this relationship have for pulse diagnosis?
The pulse can be used to assess the state of qi via blood palpation. Pulsation.
In Su Huan, chapter 17, which condition is not listed as a factor that makes dawn the best time to take the pulse?
Yang qi has been fully consumed.
Which of the following is explicitly stated as a limitation of using pulse diagnosis alone for diagnosing phlegm?
It must be excluded in cases of pregnancy.
Pulse diagnosis can provide a picture of the whole body, a capability shared only with which other diagnostic method?
Tongue inspection.
Which of the following best describes the relationship between the five yin organs and the pulse?
All four other yin organs have a relationship with blood and therefore affect the pulse.
What is the primary reason why qi cannot be felt directly except by certain practitioners?
Qi is a subtle energy beyond ordinary tactile perception.
Which of the following statements about pulse diagnosis and its learning curve is accurate?
Proficiency typically requires years of patient practice.
A deep, weak Kidney pulse on both rear positions can diagnose kidney deficiency even in the absence of other symptoms. Which diagnostic principle does this illustrate?
Direct organ specific pulse identification,
Which of the following best captures why the pulse is considered an art rather than merely a technique?
because it demands deep understanding, sensitivity, and lifelong refinement.
The pulse reflects the whole complex of qi and blood. Which of the following is not a component of this complex?
The balance of gut microbiota.
Which of the following would be an inappropriate time to take a pulse for optimal diagnostic accuracy?
After vigorous exercise.
Which of the following best explains why a slippery pulse is associated with phlegm, excluding pregnancy?
The slippery pulses reflect a smooth, ruling quality akin to phlegm's texture.
The pulse can indicate the state of qi and blood as a whole. Which other traditional diagnostic sign is said to come anywhere near this holistic capability?
Tongue appearance.
The pulse is a manifestation similar to symptoms like thirst or dizziness. What distinguishes pulse diagnosis from these other manifestations?
Pulse alone can diagnose a pattern without other symptoms.
What does the term low channels refer to?
Secondary pathways that distribute qi and blood between primary channels.
Which of the following best reflects the relationship between Western and Chinese interpretations of the heart's role in the pulse?
Both view the heart as a source of pulse generation, true for different reasons.
The pulse is felt on the radial artery, where the lung channel flows. Which of the following implications follows from this statement?
Changes in the pulse may reflect lung qi disturbances
Why might a practitioner observe the luster, tingling of the eyes alongside pulse taking?
to help decide when the five yin organs are full or empty.
Which of the following statements about the development of pulse diagnosis skills is true?
Mystery requires lifelong practice and continuous refinement.
What is the primary role of Mu points in acupuncture?
They connect organ energies to specific anatomical locations for diagnosis and treatment.
Which meridian are most Mu points found on?
Ren, Ren meridian.
How do Mu points influence organ-related disorders according to the theory?
By serving as energetic junctions that correspond to organ locations to facilitate targeted treatment.
What is the significance of the stomach Mu point, RAN 12?
It is a critical point used to treat various stomach disorders due to its anatomical correlation.
How does scalp acupuncture complement Mu point theory?
By stimulating brain areas corresponding to Mu points, enhancing treatment outcomes for organ and neurological disorders.
What neurological condition in scalp acupuncture particularly is beneficial for treating?
Paralysis and motor control issues.
How does stimulating scalp acupuncture points influence recovery in paralysis?
By activating brain regions that correspond to limb motor control, improving neurological pathways and function.
What is the main advantage of integrating Mu point theory with scalp acupuncture?
It blends ancient acupuncture knowledge with modern brain stimulation to improve treatment effectiveness.
Why are Mu points located in the chest and abdomen significant for acupuncture?
They are accessible locations that reflect the energy of vital organs, aiding diagnosis and treatment.
What does Mu point theory emphasize about the relationship between Zangfu organs and acupuncture.
New points act as energetic reflections of Zangfu organs, facilitating diagnosis and targeted therapy.
What is the primary function of the auricle or pinna?
Capturing and directing sound waves into the auditory canal.
Which part of the auricle is described as the curling brim?
Helix.
What is the function of the tragus in the auricle?
Act as a protective flap and assist in sound direction.
Which structure in the auricle has a Y-shaped configuration?
Anti-helix.
What is the helix tubercle and where is it located?
A small bump in the posterior superior upper part of the helix.
Which feature separates the tragus and the antitragus?
Intertragic notch.
What characteristic differentiates the earlobe from other auricle parts?
It lacks cartilage and is composed of soft fleshy tissue.
Where is the auditory meatus located and what is its role?
In the inferior concha, serving as passage of sound waves to reach the eardrum.
Which part of the auricle is important for structurally connecting the ear to the skull?
Superior auricle.
What role does the concha wall play in the auricle's function?
It connects the concha floor to the antihelix and helps direct sound waves.
Which acupoint pair is specifically targeted using surface scraping from the lateral to medial aspect of the knee?
Yang Guan and Yang Ling Quan.
GB33 and GB34. Why is scraping contraindicated for severe varicose veins?
It can
Exacerbate venous stasis.
exacerbate venous stasis and cause hemorrhage.
Which of the following describes the physiologic rationale for the tiptoe exercise in preventing edema?
It activates gastrocnemius pump, enhancing calf muscles venous return.
The meridian associated with bladder 40 primarily runs through which anatomical region?
Posterior knee and lower back.
Okay. So this is a very good point for issues on the posterior. Which technique is described for GV4 Mingmen in the protocol?
Surface scraping from up to down until skin reddens or sha appears.
In traditional Chinese medicine, the deficiency of vital energy and blood causing lower limb soreness corresponds most closely to which pattern?
Spleen qi deficiency with blood stasis.
The acupoint stomach 35 is located in relation to which bony landmark?
Inferior and medial to the patella lower border.
Yeah. Which of the following best explains why the protocol recommends scraping bladder 40 and bladder 57 from up to down?
To align with the descending flow of yang qi in the bladder channel.
When the skin turns red or sha appears during the scraping of GV4, what physiological change is most likely occurring?
Localized capillary hyperemia due to histamine release.
Which of the following statements about the method single angle pressing and kneading is accurate according to the description?
It is applied 15-20 times per point until soreness and distension are felt.
The modern sedentary lifestyles contribute to lower limb ache primarily by what mechanism?
Diminished circulation of vital energy and blood due to inactivity.
Which acupoint is associated with the gallbladder channel and is used in the protocol to address lower limb soreness?
All of the above.
Yeah, GB 30, 33, 34. If a patient presents with severe varicose veins, which sequence of management is recommended?
Surgical operations, then post-operative protection, avoiding prolonged sitting or standing or sitting.
What is the clinical significance of SHA appearing on the skin during scraping?
A sign of successful stimulation of the meridian and local microcirculation.
The combination of GB4 and bladder 52 in the protocol targets which organ system in TCM theory?
Kidneys and bladder.
Which of the following best describes the intended effect of pressing stomach 35 on the knee gently after kneading GB 30?
To support the chi of the key kidney channel flowing to the lower limb.
In the tiptoe regimen, how many repetitions constitute a single group?
12 repetitions.
The protocol advises that scraping should be performed until the skin turns red or SHA appears. From a biological perspective, from a histological perspective, this color change most likely reflects which process?
Vasodilation of superficial capillaries.
Which of the following is not a recommended acupoint in the procedure?
LI4.
Fluid metabolism is a benefit of scraping. Which TCM concept does this most closely align with?
Transformation of phlegm damp.
Which lifestyle modification, when combined with scraping, would most directly mitigate lower limb heaviness in middle-aged individuals?
Incorporating frequent short walks to enhance chi and blood flow.
Which of the following best explains why the protocol specifies press and knead these two acupoints 15 to 20 times, respectively, until soreness and distension are felt?
To ensure activation of mechanoreceptors that trigger meridian chi flow.
Congratulations,
Thank
and
you.
see you again next time.